Welcome to Capital Conversations. I'm Marty Owings.
And I'm Ahndi Fridell. Tonight we're going to be joined by two lawmakers with opposing views on health and human services. We'll talk to them a little bit about constitutional amendments and the stadium vote. Later on in the program, we are going to be joined by a group of party activists, a conservative, a liberal, and an independent. And we'll get their take on all the issues going on up here at the Capitol.
As always, we invite you to participate in our interactive political talk show. Just send us a tweet at MNCapNews or check out our Facebook page at MN Capital Conversations. Leave us a note. We'll ask a question of yours on the air tonight. Okay, we're pleased now to be joined by DFL Representative Erin Murphy, who represents District 64A in St. Paul, and you're in your third term.
Correct.
Right, welcome to the program. Representative Jim Abeler, he's a Republican in his seventh term representing District 48B from Anoka.
Yeah, how'd that happen, huh? 7 terms.
7 terms. It's been a while, hasn't
Yeah.
it? Was there an 8 in front of the number? No, that wasn't that long ago. It was 90s, right?
Yeah, 98.
98. All right. Thanks for coming on the show tonight.
Thanks
Glad
for
to be
having
here.
us.
Good to have you.
Representative Abeler, you're in your second year as chair of the Health and Human Services Committee.
Yes.
And you were critical of the governor signing the medical assistance, early medical assistance legislation because of the federal funding. At the time, you indicated a hope for reform for the general assistance medical care, that it would have been adopted. Can you talk about what reform you were hoping for and looking at?
It's only a 20-minute show. I'll try to be brief about it. What we were trying to do was capture some of the reforms that we'd already developed. Actually, Representative Murphy had developed some of those in a way to try to serve some of these very chronically ill, very, they tend to go to the hospital a lot, to the emergency room, and to try to find ways to manage them better. My concerns also were the sustainability of the money that the feds had promised us, a concern I still have. That hopefully that'll still keep coming, but I can't imagine how they keep writing all the checks. Luckily, in the session that ensued with Commissioner Jessen, who's a reformer and a very good commissioner, and we worked on a lot of ways to make the money go a bit further and coordinate care for some of those folks, and did some competitive bidding, and achieved a lot of the goals I was after. So I'm pretty happy about that.
Well, Representative Murphy, if I recall correctly, it seems like those were kind of dark days when the GAMC, we had to wait around for the people to come out of the governor's office to decide if there was going to even be any general assistance medical aid. And then were they CCOs or coordinated care? I forgot the scheme, but I heard somebody in the DFL call it a Ponzi. I'm not sure how that, your reaction anyway.
So general assistance medical care, when it was in law, served Minnesotans who made $8,000 a year or less, primarily people with chronic conditions, mental illness, chemical dependency, heart failure, diabetes, etc. So as Cal Ludeman used to like to say, the poorest of the poor and the sickest of the sick. I think there is a lot of agreement within the legislature that for a population with that much disease burden, we should focus on how to keep them healthy and out of the hospital. However, the population being served is a transient population. Part of it's a homeless population. So the current delivery system in Minnesota and the way we pay for care doesn't do enough outreach to that population. So we came up with what was called a CCDS, or a coordinated care delivery system. The model in and of itself is not flawed, but how we paid for it and how it was distributed created problems. People that were served in general assistance medical care lived all over the state, but there were very few hospitals that participated, and they weren't paid very much to do it. So while I think we agreed on the idea that providers and human service organizations should do more to keep this population of patients healthy as possible and out of the hospital, we didn't really flex the policy muscle or the funding for it as much as we could have to see the gains that we could have. So we've got work to do there. I think there's agreement on the policy idea. How we implement it, we had disagreement over it at the time, but I would never have called it a Ponzi scheme.
Well, I can hear that from you. But what about the asset threshold as a follow-up to that? There's been some changes this year, and it seems, well, it's been widely reported that the asset threshold has to get has gotten a lot lower now, or it's being proposed to be a lot lower. So basically, I don't want to mischaracterize it. So is that correct, or?
Are you talking about people in our public health programs?
Right, anybody that has to go and get sort of this care through the system, they almost have to be, they can't have assets,
Well, I
very
think that,
few assets.
I think for people in medical assistance, and this is a result of a federal change, will no longer have to meet an asset test in the state of Minnesota. But
So
we
you don't have to lose your house and everything you own first before you
Well,
go get.
people making $8,000 a year probably don't have a house. They may have an apartment. They may own a home, but it's not that likely that they do. But if they had a home as an asset, they wouldn't have to lose that in order to do it. Our asset tests haven't required that people lose their home anyhow in the past.
No,
No.
but it's money in the bank and items that you can turn into cash.
Yeah.
Sure, okay.
But with our state programs, there
Yeah.
are still asset tests.
Okay. Are those under scrutiny for change?
Anything is always open for change.
You haven't heard any new proposals this session? And
Well, under the ACA, eventually people up to 133% of poverty will have no asset test. And if you're in the other programs, in the exchanges, if you're going to get Minnesota Care and so on, I don't know how the subsidies work on assets on that. Is there assets for that?
I don't believe there would be an
Well,
asset
just to
test
be
for
clear,
Right.
we're
exchange.
talking about the poorest of the poor. I mean, these aren't people that,
Right.
routinely, have money to go to the Mayo or something like, right, so. The
Now,
people-
in the end, did you get all the hospitals participating, or is it still just the
This-
few? I
this-
mean, I know
yeah.
that was.
Well, there were
was
four
four.
originally.
Uh-huh.
And then the outstate ones were paid 18 cents on the dollar if they would work on people, something like that. And so they did that until the program was abolished when the Governor Dayton signed the expansion on January 5th, was it?
I-
His first
It was his-
full day in
yeah,
office.
right.
He got sworn in and then.
Right.
So then
So-
the program was abolished
Right.
effective at that
It was
time.
replaced, right?
Okay.
I
Right.
mean, essentially.
replaced, yes.
federal.
So last week, DHS Commissioner Jessen let it be known that the federal government is investigating the use of Medicaid dollars by the state of Minnesota. Representative Murphy, how are those Medicaid dollars used by the state to help fund its public health care programs?
In both medical assistance and in Minnesota Care, the people enrolled in those programs go to get their coverage through a health plan, just like someone in private employment. So the health partners, Medica, Blue Cross Blue Shield, are the programs that people in Medicaid and Minnesota Care go to get their coverage, just like I do, or as another person does who works in the private sector. So the Medicaid dollars flow through the state and into the health plans and then to the providers. Commissioner Jessen came to talk with us about, she came and reported to us that there was an investigation, but she didn't share a lot of detail about the matter, and she's not allowed to share much detail about the matter. So officially, I don't think we know that much about the subject.
Well, that's what I was
That's
going to
correct.
ask, Representative Abeler. Do we know which federal agency is even doing the investigation, and what do you think's the cause of the probe?
It's anybody's guess. It might just have been time to look into things. Maybe there was a whistleblower. Maybe they discovered something. They really didn't tell us anything about the who, what, why, when, the scope of it. And,
Is there an expected date of when we're going to find that out?
or when we find out, we don't know that. We don't know anything.
Okay.
You have a panel that doesn't know anything. So the four of us on this topic are, and it's just
I
actually,
don't buy-
they're barred from
Come
telling
on.
us that.
Those
so-
that know aren't telling, and those that tell don't know, is what you're saying.
Yes.
All right.
That actually
All
sounds better than how I said it.
right. Well, I'm just saying, it's typical up here. We ask a lot of questions.
So both of you, one of you could take this first. Last week, Senator Nino introduced a bill to conduct an independent audit of spending on Minnesota's public health care programs. Representative Abeler, do you support such a step?
We just had a hearing today for 3 hours with about a dozen witnesses or more. The bill is moving. It is strongly supported bipartisanly. Representative Gottwald, who's the chief author, had Representative Haas and Representative Lane by his side as he presented his
Democrats.
bill. They each had their own bills that are very similar. And so they're merging their efforts, and it was very strongly supported, wouldn't you say?
Unanimously supported.
Yeah.
Yep.
We want to know where the money is going and what we're getting for it.
And do you see there's a problem, or just generally you think this is a good idea? I mean, has there been evidence of a problem?
I think that for a number of years, this isn't really a new topic for the Minnesota House or for the legislature, in fact. And we have been, I think,
Which
moving
part,
along this,
Rep. Murphy?
with the issue of the question, are we getting good value for the dollar that we're spending? And is the information transparent in a way that we can make that judgment as legislators? It is a question that has been a subject of debate in the Minnesota House since I've been elected. Today's bill, I think, brings a remedy that was widely supported with an independent audit to suggest that we should have someone outside of state government take a look at the books and verify and give us confidence that the dollars that are being spent there are being spent well.
One of the key parts of testimony that I thought was the most salient was, I think 3 different people used the word trust. And there just isn't a lot of trust between the outsiders and then the HMOs, and they're not intrinsically bad or good, they're just entities that do work. But over the years, you get feelings that build up, and I think the trust level has not been there for good and bad reasons. I think this sort of an audit will help get back to the point we can be better working partners.
Well, as a follow-up to that, last year Governor Dayton said he wanted to start moving DHS away from setting the rates for public programs and decided to allow competitive bidding by the HMOs. How's that going so far? Has that made any difference?
Well, I think it's showing a savings in the budget, in the state budget. I also think it clarifies the relationship between the department and the health plans, which are vendors
So
for the
now
state
we
of
approach
Minnesota.
them more, the state, I mean, by
Yeah.
you approach them more as if it was a company going to an HMO saying, give me some competitive bids, or a number of HMOs.
Well, to say this is the book of business we're looking for,
Okay,
and entering into negotiation around that.
okay.
I just think it has shifted the relationship in a way that is important in Minnesota, and we'll
Sure.
see what it yields into the future.
Yeah, they used to
Yeah.
be much more sacred, I think, and so now they become vendors, as you suggested. And I think that lean times press people to define their roles more, and I think they moved from a favored status to they'll be back to a neutral status. I think they had pendulum swings, but they're valuable, we need them,
Okay.
and we want to use them still.
Switch gears a little bit.
Well, let me ask kind of a follow-up. So you guys seem to be on the same page and everything's happy on the Health
We
and
can argue
Human
about
Services
something.
That
Committee.
usually spells something
Oh.
fishy going on out there. When the Democrats and the Republicans start to agree, usually the people end up suffering for that. I just want to be on record saying,
Only harm can happen from that
Should we
kind of
argue?
working relationship.
But Representative Murphy, is there anything that you're not seeing legislation? I mean, it's a huge part of the budget, Health and Human Services. Is there anything that as citizens or sort of you feel that we're missing out on?
Well, I think this would be a point where we would have a lot of disagreement. Where we have been in the last 4 years is, a lot of budget balancing, and a lot of the balancing and the cutting has taken place in Health and Human Services. I think over the past 4 or 5 years, we've cut about $4.2 billion out of Health and Human Services. I worry about that and what it means for Minnesotans, seniors, people with disabilities, people who are sick. But at the same time, we had to balance the budget. We've done a lot of reform in Health and Human Services, and we have some bipartisan agreement on reform, and there's a lot of disagreement on where we go going forward. But we're doing our best to try and work our way through that. I think this session, we're probably doing less debate on the things over which we disagree, and we're talking more about the things where we do agree, because we don't have so much budget pressure. And that's probably, I think, a good thing for Minnesota in the short term. But we have hard work ahead of us.
Representative Abeler?
Well, I think that's really correct, and actually we've become friends over our time here. We don't agree on everything, and we probably shouldn't.
It would be weird.
It would be really weird.
I
And
mean,
the
just for a
question-
legislature to all agree on everything would be.
And
We're
good people
suspicious.
disagree. And so in my view, and I don't know if you disagree with it, but the spending track that Human Service was on was not sustainable. Going up 22% a biennium when revenues are going up 2 or 3, especially in a soft economy, and people might need the services, but how are you really going to afford to pay? My concern goes beyond that to the federal level, where they're borrowing 44 cents on the dollar, We get $13 billion every biennium from them. 5.5 or 6 billion of that's borrowed. And so people, my clarion whatever call has been to like, this might be, you might not get all the money someday. And not that I wish we do anything less for some of the people we serve, but you just can't make all the payments. And if we raise taxes $1.4 billion or whatever the argument was about, will that harm the private sector? Good people disagree, but it surely won't fill the gap anyway. And so whatever happens in the future with taxes, I took as my role the chance to try to change the growth curve a bit, still spending over $1 billion more in state money this cycle, but less than we expected. It's been quite a challenge, and Representative Murphy has gone for the ride. It's been a wild ride.
Well, we only have a couple minutes left, so let's, we got to hit some other issues
Sure.
fast. What about amendments? Representative Murphy, we've got the marriage amendment, which is already on the ballot. There's talk about a right to work amendment, a voter ID amendment, a supermajority amendment. Where are you at on some of those things?
I don't think we should move any of them forward. I hope we don't. I think the supermajority would paralyze.
Let me stop you right there and challenge you a little bit.
Go ahead.
Is that a disdain for amendments in general? And if so, how did you vote on the Lessard, the arts and the environment?
I did vote for that.
So that amendment was okay, but these suck.
They you know, I can break it down for you.
All right,
So,
all right,
as we have
sounds good.
seen in other states, when legislatures have put a supermajority in place in the Constitution, it's really ground their legislative process and their budgeting process to a halt. I think that's a problem. We could put a voter. I'm just going to mess this up tonight. Voter ID in the Constitution. We still have to do enabling legislation behind it, which is going to be controversial, and it's going to cause a lot of disagreement, so we may as well just legislate it from my perspective. And I don't have any understanding of why we would put something like right to work in the Constitution. It's an issue where decent people disagree, but why we would try and strip people of their ability to collectively bargain and use a union to equalize the power between an employee and our in our state constitution is beyond me.
And how about the marriage amendment, which is already on the ballot for November?
Well, I was a part of our caucus that tried to get that sent back to committee, because I think it's going to bring a really harsh discussion to Minnesota, and I think that's unfortunate.
What about, Representative Abeler, what are you hearing from your constituents? Is that going to drive your constituency to the polls come November, this marriage amendment issue?
I think a lot of people care about it. It's been discussed for 6 years or 8 years, all the time you've been here, and probably longer, about being a ballot initiative. Frankly, I think the positions of Minnesota is evolving on the topic, and I think it was a slam dunk 8 years ago. I don't know that it is now. I did vote for it, and I think the discussion needs to be brought forward somewhere, and I don't think it's unhealthy to have the debate. Hopefully the people can be respectful while the discussion goes
I
forward.
hope so.
That's what I'm hoping for. And whether you agree with somebody or not, if you can be respectful in the discussion, many more good things happen. And you can actually find a solution that no one thought of in the beginning.
Okay, there wasn't a lot in that a question, or no, I'm not going to say the answer. It's fine. Let's go to stadium. I guess a lot of people care about that. So
Go
I don't mean
Vikings.
to. Did I express my disdain for the stadium? Who cares? Anyway, are we going to have a stadium deal done for the Vikings, or what about that?
I hope so. I want to vote for the Vikings. I'm afraid they're going to go. And whether you like them or not, they do bring a lot of interest to the state. They're an asset. And, you know, I'm just amazed by the dialogue that's gone on.
So
Which
as a
part about it?
Republican,
Yeah.
how do you justify the taxes that are going to have to be?
Well, the latest proposal doesn't involve any taxes, so it's easy. So if we use some gambling pull
But everybody here in this
tabs.
right
and-
here row knows that that's not going to be the one that gets adopted, more than likely, right?
Well, the governor's taken sales tax off the table, which really did harm to the Ramsey proposal. And I thought that wasn't so unreasonable, and it's nice to spread it out, but you have to be pragmatic when you're legislating.
Fair enough.
But I admire the Ramsey commissioners for coming forward with, I think, the best site and a viable plan. I think Arden Hills is where it should go.
Representative Murphy?
So I have been busy trying to understand the different proposals and what they would mean for St. Paul, and for the businesses in downtown St. Paul, and for the property taxpayers in St. Paul. And you know, I have a lot of people in the district I represent who do not want to see public dollars going into the funding of a Viking stadium. And I have shared with them that I share that view, but I want to make sure as we're having this discussion that we don't do harm to downtown St. Paul. I am inclined to support the idea of a regional authority that would help us, negotiate the deals that end up going into the XL and the Target Center, et cetera, so that outside influences aren't ratcheting down the revenue that would come into those resources and help our cities. So
Or
that's
maybe
where
a
I've been spending my work.
tax in Minneapolis and then the stadium in Ramsey County.
It's a jobs bill.
There are jobs attached. That's true.
Ramsey County, welcome to. Well, what about the ballpark for the Saints? Any thoughts on that? Is that okay?
I like that. I like the idea of bonding for that. I think it'd be good for
So
downtown
if they're
St. Paul.
small millionaires, we'll subsidize them, but if they're big billionaires, we're not getting them, Ziggy. But Mike Veck, he's suffered out there for a long time at that rickety ballpark.
You know,
out there.
a lot of
With no
Minnesota families
bathrooms,
and
right?
a lot of,
No
Twin
bathrooms.
Cities families go to the Saints.
Yeah.
And for a modest ticket price, they get in and have a good night of family
Oh,
fun.
I believe if they build a stadium, the ticket prices won't be as modest, but what do you think?
You're a cynic.
You guys have beat me down enough up here where, no, I'm just, it's always a pleasure to see you both, and
Oh, thanks for having us.
thank you for taking the time to come on and share your, insights with our viewers.
Yeah, great.
Thanks for having us.
Hope they learned a lot.
Well, I think they always do when you guys are on. Coming up in a moment, we'll hear from a conservative, a liberal, and an independent about what's going on up here at the Capitol and beyond, and we'll be right back after this message.